Hi, I'm Dr. Anna Cronky with Clear Child Psychology, and I'm in full work from home mode right now. My husband is on a job site and my 2-year-old is here, so you might hear him. But I want to do a quick demonstration of the clinical aspects of CADE, which is our summary diagnostic measure that we use virtually with families as part of our autism assessment process. So I'm signing into a test account now to show you guys a made-up case. You'll see when you enter CADE, there's all kinds of videos that show you how to use our system. And those are accessible to anyone who's using the system. When you click to enter, you'll be here in my test account, and I'm going to put a test case that I have in. Okay. So now I've found some existing assessments, and I'm just going to go ahead and take you into one of them and show you how this CADE platform works. So you'll see here that we have 11 domains on our left-hand side, right? So we spent a lot of time in our clinical work validating these domains, doing research, writing about these areas that we feel are part of comprehensive assessment. And when we're looking at autism, we really want to assess broadly, so we can try not to miss things that might be going on with a child, teen, adult who we're assessing. And so you can see in each of these different domains, there's a number of assessment areas and items. And so we're here in the clinical column where I've already completed the measure, so I can show you some of the analysis. But in each of our areas, we have a question and more details on how to answer that question. Clicking here, as well as a lot of resources. So let's look at social motivation. We have image resources for all of our items that give some brief descriptions about what we're looking for. And the reason that our platform contains all this information is because parents are going to come in and answer these questions for their child before you even meet with them. So as a clinician, you get a little information about what the parent concerns are prior to doing an assessment with them. So parents tell us this takes them 30 to 45 minutes to go through and complete. It's on a 7th grade reading level. It is only in English right now. So additional raters, you'll see these rater columns. These are teachers, psychiatrists, therapists, school psychologists, special education teachers, anyone who's working with a child. You don't have to have any raters, but before we do an initial consult virtually, we like to have at least a teacher in the system giving us some feedback on what's going on with their child. Now, their portals will look differently than this one because this is a summary portal, so you can see everyone else's data. They will just see questions and resources and be able to answer those. When you come in as a clinician, before you do an initial consult, you can simply go to our Analyze tab. Let's look at what the teacher thinks is going on here, and you can see summary data. So understanding for Orion, an 11-year-old boy, that his teacher is really concerned about his eye contact, really concerned about this expressive language discrepancy, feeling like he talks a lot more than he listens, very concerned about narrative coherence. This child struggles to tell a story, often goes off on tangents, doesn't give you the details that you need. So as a clinician, before you even assess a child, you can see what others are thinking about this child's profile. So that's a really neat thing about CADE. Now, after you've done your initial consultation, you're going to decide what kinds of assessments to do with that child, and that's entirely up to the clinician. We often do an ADOS-2, parts of a WISC. We might send a Connors, we might send a Vineland, we might send a BASC, we might send other rating scales or try to do other measures depending on what's going on with the child. Then, after we've collected some more of that data, as a clinician, we're going to come back into input and make our responses in all of these areas. So again, communicating, socializing, daily living, moving and sensing, understanding, learning. And that way, once we've sort of finalized our assessment, then when we go to analyze, and you see me up above, you can come over here and look at all of your data. And the reason this tool helps us so much in our virtual assessment is that just like I'm doing here in this video, On Zoom, I can screen share. The parent and I can talk. Our faces will be up in the corner of the screen. And I can say, okay, so here's what I think is going on socially for your child based on all the data that we've looked at. And I talk to them about this profile. So I don't just say, your child has some social problems. I talk in very detailed about each of the areas. And I can also show them, okay, well, this is what your teacher noticed. And this is what your therapist noticed. And I can talk about some of the differences and why I'm saying that a child has certain areas that are more challenging than others. I can show them their own data and say, okay, this is what you're noticing. And we can also talk about overall concern levels. So this parent's very concerned about social behaviors, moderately concerned about communication, moderately concerned about daily living skills. So we can get into the details, but showing them these symptom-based profiles helps families and the work that we've done to really understand the areas that we're concerned about. And then we help them develop treatment priorities and goals around these. For the clinician, we also get an autism score. So now this is validated. We did a validation study about a year ago. We had 191 cases, and we are looking at our autism scores in comparison to the ADOS and getting a really high rate, 98% consistent between the ADOS and our measures. So one of the things that's neat about the clinician is that they can look at autism scores if they would like to as part of this assessment. Now, when you're looking at assessment with a parent, this is what you're going to be looking at, right? So you're going to be looking at the different domains, and you can see overall profiles of strengths and weaknesses. Our system also provides recommendations. These are going to print out into a Word document at the end of your assessment if you'd like to print one. And so you can cut and paste. You can cut and paste graphs that you might want to share in a report, recommendations, or you can choose to do the report exactly the way you've always done them. You don't have to use any of our resources here. But the system will give a resource and a recommendation for each area, and noting some areas that are perhaps more primarily important to treatment, helping to develop an idea for parents of what kinds of symptoms they might treat first. So let's just take a look here. Let's take a look at focused attention. So we try to give something that a family can do at home. So we talk about here using timers to extend the amount of time a child can tolerate an activity that's not particularly pleasurable. We talk about setting those timers and using them places like the dinner table and extending. We talk about posting schedules and chores. So we're trying to talk about things that a family can do. And then the other thing we address in our recommendations is, what could the school do to support this? Because a lot of times families are not sure what they can ask of their school. So we try to give that, as well as bibliotherapy if we have some ideas there, and ideas of some resources that parents might be interested in. So we're offering these that clinicians can share with parents. Certainly they don't have to. So I just wanted to give you a brief look at our system. Again, you can see the summary charts and graphs appear for all of our different assessment areas and allow you to show the parents what you're thinking, what you've kind of summarized from your full assessment in a way that they can virtually share with you, understand, ask questions, and really kind of digest this. We certainly do put all of our BASC tables, Vineland tables, in the end of our reports. But again, we're trying to hone in on symptom profiles for families. So while we provide all that information, we're trying to focus our feedback sessions with families on the symptoms that they're seeing and talking about sort of more direct ways to treat and intervene with those. And again, for each of the symptoms, if you want to kind of talk about, okay, well, these are my clinical ratings, this is what you noticed, let's talk about the similarities, let's talk about the differences in the classroom, this is what your teacher is seeing in the therapy office, this is what your therapist is concerned about. Here's your school psychologist and their worries. So it's really a neat way to summarize data virtually and get a lot of opinions and information to a family in a way that they can digest that and understand it. So thanks for taking a minute to look at our system and understanding that we are now all working from home. So. Thanks so much.